Hello, I'm joined today by Michael Neofytides, the Assistant Vice President of Revenue Cycle Learning and Development for NYC Health and Hospitals. Michael will be joining our training panel taking place on February 21st as part of the healthXchange's Patient Access Online meeting. Michael, thank you so much for joining us. We're so pleased to have you on today. People that we talk to in revenue cycle and patient access, there's so much discussion about training, whether it's new hires and onboarding or ongoing training or the latest certifications. There's just so much of a focus in healthcare finance and revenue cycle on training. But in many organizations, there's a lack of formal structure or support for these types of efforts. Obviously, at NYC Health and Hospitals, there's a real culture, it seems, of continued training and education. Could you talk a little bit about the scope of your work and how the role has evolved?
Absolutely. So, being in the industry for about 25 years now, there's definitely been a void as it relates to learning and development. There's always been a focus in the revenue cycle area on the patient access, patient accounts components, revenue integrity, and HIM. But I always strongly believe that learning and development is one of those pillars of the revenue cycle organization that was needed. There was certainly a void. HR does a wonderful job providing their education on mandated topics, developing leadership skills, and some of those essentials that are needed as healthcare system employees. But revenue cycle learning and development, it's a bit deeper. We're past those days of revenue cycle solely being data entry clerks, individuals who just jotted down a piece of paper information regarding to billing and sending those bills out the door. We're highly regulated as an organization, as a healthcare system. We know that, and for good reason in many areas. So learning and development was something that was needed to help better enhance the skill set of individuals doing the work. Not only teaching them the work, but helping them feel good and positive about the work they were doing. When I had an opportunity to move over to New York City Health and Hospitals, it all started with the vision with my chief revenue officer. And when I initially met with her, I immediately knew we had the same vision, which brought me over to New York City Health and Hospitals. Since then, it's been since 2018, I've been with New York City Health and Hospitals. We've been moving together in that same path of learning and development. We've centralized learning and development where previously it was owned by each individual facility. We have 11 acute care facilities and over 70 ambulatory care locations across the boroughs. We knew that we needed more. We needed a what we like to refer to as a one voice approach. And that one voice approach, it's not about just owning the learning and development space, but it's ensuring consistency in the way we deliver that education, in the way we communicate it. It's also making sure that every employee throughout the enterprise, and our focus is 5,000 plus revenue cycle stakeholders across the enterprise, it's making sure that they all have the same access to education and they're all getting that time they need for that education.
It sounds amazing. I mean, the fact that you've got this consistent approach is really unique and really terrific. You know, based on feedback from our audience, staffing continues to be kind of a top issue for teams. And with 5,000 roles, I'm sure that this is also a big issue for you. Could you talk a little bit about your perspective on the staffing challenges that the industry is facing and how your team, through this really comprehensive and unified training, is helping to alleviate some of those challenges, some of that pressure?
Absolutely. We like to take what's called a train to retain approach. We've developed a new revenue cycle new employee onboarding program. It was rolled out to assist our facilities with their onboarding needs for their new employees. We're taking some of that work out of the hands of the facilities and we're helping with that onboarding process. We understand that facilities deal with the day-to-day operations, staffing issues. We know they do occur. And we also understand that management at the facilities don't always have the time they need to appropriately onboard their employees. So through this new revenue cycle, new employee onboarding program, we've created these blended learning tracks. I believe there are approximately 14 blended learning tracks. And what the learning tracks do, pretty much they're the foundation of our onboarding program for the revenue cycle organization. So what they do is they pretty much place each new employee into the appropriate track based on the work or the tasks or the work streams that they'll be assigned to. So you have registration work streams, billing work streams, financial counseling work streams. So what this allows us to do is really hone in on the needs of those new employees who join the organization and are going through this program.
And I think that, what you said in the very beginning is really the cornerstone here, is the train to retain. And this just is such a great approach. And we're really looking forward to having you on our training panel coming up in February. I'm sure there'll be lots of questions for you. Thank you so much for coming on and for sharing your perspective. And again, we'll see you in February.
Thank you so much.
Thanks.